Over 2 million COVID-19 vaccine doses have expired as Kenyans remain hesitant to roll up their sleeves and get the jab. Now, the Ministry of Health says daily vaccinations have dipped from 200,000 to around 7,000 a day. The problem cuts across the East Africa region with an estimated 40 million COVID doses at risk of expiry, due to the vaccine apathy from the masses. And as Mary Mwoki reports, the World Health Organization preparing to declare that COVID-19 is no longer a public health emergency.
When COVID-19 doses first arrived at the Jomo Kenyatta International Airport, March 3rd, 2021, they were met with a sigh of relief for a country that was struggling to tame the COVID-19 wave that was smack in the middle of lockdowns and an economic meltdown. The COVID vaccines represented hope for families that had lost loved ones, and that full vaccination would see the COVID restrictions lifted and Kenyans finally go back to their normal routines. So precious was the jab that the government had to come up with a rollout plan in order of priority because it simply wasn't enough for everyone. At the height of the rollout, Kenyans were scrambling to roll up their sleeves and get the shot, creating long queues in health centers across the country. 2 years later, the COVID-19 vaccines are not as popular anymore.
We have witnessed over the last 1 year a significant dip in the number of vaccinations that are happening. I think we had a high of 200,000 vaccinations a day in March 2022. But that has now moved down to an average of about 7,000 vaccinations a day.
Dr. Mulwa attributes the sharp dip in vaccination to a low-risk perception among Kenyans who seemingly believe that the pandemic is over. Due to the downward trend in the vaccine uptake, the country is riddled with stockpiles of doses that aren't moving because of vaccine apathy, and over 2 million have gone to waste.
Now we have also continued to have expiries, and I think in total we easily would have about 2.3 million vaccines expiring. The major reason for expiries is because, one, the lifespan of most of these vaccines that were available, especially through donations at manufacture, is about 6 months.
The vaccines currently in store and at risk of expiry include Johnson & Johnson, Pfizer, Moderna, AstraZeneca and Sinopharm, donated through the COVAX initiative. The situation is the same in the East Africa region, where member states have recorded high numbers of expired doses. Uganda's Ministry of Health says it is stuck with over 13 million vaccines that are expected to expire in the next 4 months, with DR Congo, South Sudan and Tanzania contending with the same challenge. Kenya missed its COVID-19 vaccination target for 2022 by 4.1 million. The government had planned to vaccinate at least 27 million adults by December 31st, but did 23 million by December 15th. Dr. Mulwa says the government has cumulatively received 31 million doses of COVID vaccines and has managed to fully vaccinate only 38% against a target of 70%.
In terms of regional distribution, counties like Nairobi, Nyeri, Kakamega, and the more urban counties, Nakuru, have been able to get close to 60%. I think Nairobi has the highest vaccination rate of about 58%.
Data from the Ministry of Health shows that vaccination is highest in urban counties and lowest in hard-to-reach counties. With hard-to-reach counties like Wajir, Mandera, Garissa and Samburu recording a fully vaccinated percentage of less than 15%, with Mandera recording 10.1%. 7 million doses of the COVID-19 vaccines are still in store, with the government embarking on a sensitization campaign to get unvaccinated Kenyans to go for the jab. This as the World Health Organization gears up to declare an end to the COVID-19 pandemic as a risk to global public health. The WHO boss Tedros Adhanom says the virus is becoming more like seasonal flu. Mary Mwoki, Citizen TV.